Hello, I hope you had a good weekend, and I want to bring you up to date on the latest COVID information that we have, some changes from last week. So, the Hospital Association and the Department of Health have eliminated the red, yellow, green visitation rules, and we've decided that we'll do that as a system, so all rules will apply to any of the three hospitals in our system. But we really want to try and encourage people to come back because here's what we're seeing. We're seeing a very high transmission rate in the community, and two, our highest number of COVID patients that we see is actually a secondary diagnosis. They're coming in for surgeries or coming in for something else, and they don't even know they have COVID. So the good news is there aren't a lot of hospitalizations, and we're managing it as best we can. We've seen people be really sick, not hospitalized, but knocked them out, couple days, really need time to recover, and they need a full 10 days to really get back on their feet. So please pay attention to these things. It's as important for yourself as it is for those that you're around, and obviously be extra careful with those individuals who are immunocompromised or the elderly and have a variety of health conditions that you need to worry about because, again, COVID does impact people very, very differently. So I'm thrilled to tell you that there is an organization called Leapfrog that does all of the letter grades for quality and patient safety throughout the United States. And our facilities in Mullica Hill retained their Leapfrog letter A. Vineland moved from a B to an A, and Elmer moved from an A to a B. There are many, many factors that impact this, including patient satisfaction as well as our quality scores. But it takes a huge amount of work, effort, energy by our teams to really keep all of these metrics in our minds, to have the protocols in place to be able to do that, and especially during COVID. So I want to commend the teams for continuing to achieve these high ratings. We're so very proud, and obviously very proud that we can continue to provide this high quality of service to our communities each and every day. May is Mental Health Awareness Month, and I want to talk to you about a couple things. One, we know that during COVID, the isolation issues impacted many people differently. It seems to have had the greatest impact on the elderly and the isolation, as well as in the children for the lack of socialization. And we're seeing a huge demand for services. And no matter how many individuals we hire to try and meet those services, there still seems to be a great number of people in need. So I'm thrilled to tell you that we have received approval to establish a psychiatry residency at our organization. We know in Cumberland and Salem counties, 1/3 of our physicians are going to be retiring, or at least eligible to retire in the next 5 years. So the importance for us really creating that pipeline of new physicians is more important than ever. And we're very excited about these residency programs, and most importantly, excited about the residents who are so fired up about being here. Last week was hospital week, and I had the opportunity to be with many of those residents as well as with our staff. And you would just be so proud to know how proud they are to care for you and be able to provide the needed services to our community. During the CMS week, it seemed appropriate for us to recognize the acquisition that we had of the Belle Plaine Emergency Services as we cut the ribbon at the new King Complex, which is the Belle Plaine Emergency Medical Services in Dennis Township. We are so honored to be able to recognize the dedication of Chief King and his sons and the entire family and all they give back to the community. It's just one more example of how we're trying to meet you where you are and be able to be of service to our communities as well as to our patients. Until we meet again, be well and stay safe.